Hello, welcome. I'm so glad you all are here with us today. I am Joshua with Compression Care, and if you've joined us for the other meetings, I hope you've had a great day so far. If you're joining us for later ones, wonderful. I'll see you then too. But right now, I have Erin Sokalsky with me, and Erin has a lot of designations. I'm not even sure if she's making them up at some points here, but she has a lot of designations after her name: ATC, PTA, CLT, LANA, WCC, MPM. But Erin is a physical therapist assistant who treated patients for almost 10 years before moving into the compression therapy industry, where she has gained extensive experience in customer service management, marketing, and product development. With the goal of furthering the awareness of lymphedema and compression therapy, her focus has been the education of clinicians, fitters, and patients as a speaker at national and international conferences and symposiums. She currently works for Essity as the national clinical manager for lymphology and phlebology. And aside from all of those cool credentials, Erin is a good friend of mine. I really thoroughly enjoy every time we get to work together. We get to cut up, we get to have some fun, and so I'm very happy that she was able to accept this and come on here and do a little training for us. So without me running my mouth all day, which I'm good at, I will pass it over to Erin.
Thanks, Josh. I'm going to start just adding letters at the end of my name to see if you catch on
Yeah,
and if you're like, wait a minute, that one's fake. Um,
I actually read the NPM and I went, I don't know what that one is now. I don't know. So
that's my master's of project management that I got 2 years
nice.
ago for no
Okay.
reason because I felt like I needed more schooling on something.
Okay. Let's see.
Um, So, Josh, first of all, I want to say thank you so much to Compression Care, to you and everybody there. I mean, this has been an amazing day so far. I've been on, and it's just been incredible. So, thank you for putting this together. I was saying that this is really a lot. And so, I can only imagine what it's taking for you guys to put this on behind the scenes. But we are learning so much from our end. So, thank you so much for hosting this.
Absolutely.
Yeah. Okay. Well, then let's go ahead and get started. Today, I really wanted to talk to everybody about JOBST compression and how we're really supporting improved clinical outcomes. We really understand from the clinician's point of view how important clinical data is. And so we wanted to just talk through some of the studies that we have for some of our products and some of the support that we have for you out there. So, just a little bit of history, of course. Always, we like to start with this in case you didn't know that Conrad Jobst pioneered the development of the first gradient compression stockings. He had really bad varicose veins, and he was in the swimming pool, and realized that he found some relief from the hydrostatic pressure of the water, and that's how he actually. I would have thought, oh yay, I'll just stay in here forever. His brain, as an inventor and really technically minded, he thought, how can I replicate this on land? And that's how he came up with the first garment, which was our JOBST custom seam. But what I love the most about this story is the fact that it was his wife, Carolyn, women power, that really grew the JOBST business and continued with innovation and things like that. So with that, we have come up with our daytime flat knitted garments. And I just wanted to talk quickly about these with our Elverex, our Elverex Plus, our Elverex Soft, and our Elverex Soft Seamless, because I do think everybody knows about these very well. Just as a quick reminder, the Elverex is fantastic. It does have latex in it, and latex is a good thing. We actually love latex. It never touches your patient's skin because it's double covered 2 different ways. And so the latex actually helps it return to a great shape, and it allows for that compression with stretch. So it's easy to don, but yet you're still getting the compression and the containment that you need. But one of the things that I really did want to focus on was our confidence. Our confidence is our newer garment. This is really truly the next generation of custom flat knit garments. It is a 3D contour fit technology, which means it really fits nicely to the limb. So this is fantastic for patients that have some of those different shaped limbs. It's for mild to moderate lymphedema and lipedema, though. I do want to make sure that everybody knows that, because while this is an amazing garment, it's not really for your patients that have stage 3 lymphedema with deep skin folds and things like that, because it does contour so nicely. We don't want it to dig into some of those skin folds. But it's a very flexible fabric with still, again, the containment that you need. It has a double layer construction, which is really interesting, because you hear that and you may think, 2 layers, that's going to be even hotter. But when this garment was designed, it was truly designed based on the feedback that we got from patients and clinicians and fitters. And it was, garments are always too hot. They're not stretchy enough for me to get on. They don't feel comfortable. We created it with this double layer construction, because what it actually does is that first layer pulls the moisture or sweat or whatever it is away from the skin, and it pushes it to that outer layer, which allows it to evaporate, and then it keeps you cooler and drier. So it is really based on all of that feedback that we got. And another part of it was the panty design. So a lot of times we find, that the traditional panties have the seam in the crotch area, because it's like a panty sewn together with 2 thigh highs. With this design, we've taken those seams out of the crotch area, and you can see they now go back up the back of the garment. What this does is it allows for a much better fit, because a lot of times patients would say, well, I feel like I have it up high enough in the crotch, but the seams aren't high enough on the sides, right? And so we take those seams away. We have had nothing but phenomenal feedback about the fit of this garment and how comfortable it is, and not worrying about seams everywhere, trying to get them into the right location. And just to prove that, we do have some research that confirms this. We did do a study where we worked with a lot of patients on this, and you'll see the statistics here that 85% of the patients state that they can move more freely. That's that flexibility in this garment that we're talking about, that allows them, those that are very active, to have that freedom of movement without losing the containment that they need for their condition. And the general wearing comfort, 84% evaluated it as very good or good. And then, of course, that moisture management, which is huge. 92% said the management was good, or the moisture management was good or very good. And then just overall patient satisfaction, 73% would recommend the JOBST Confidence. And we do have this study linked as one of the pieces that we have for you to access after this is all said and done, if you would like to read through the whole study. This is just another slide that shows, it's the importance of this. Why we bring this to light is because if a patient doesn't wear their garment, it's not doing them any good, right? So this really does encourage consistent use and adherence for our patients with the contour fit technology, the compression that is there, the containment that they need, but with more comfort because of the moisture management materials. And so just overall, the high comfort with the JOBST Confidence. Now, as you remember, we do have the short stretch bandages. Just a quick reminder, I threw in the codes down here just so that, not that we need to talk about these, because you guys know that Josh and everyone at Compression Care has this on lockdown. But just in case you're thinking, oh, I want to get some bandages, are they covered? Are they not? Just threw them in here as a quick review. But if you've ever seen the Tricofix, the Comprolon, the Isoband, and things like that, quick reminder that that is JOBST. We do have all the products that you might need for multi-layer compression bandaging, along with the 2-layer compression systems, which we do see a lot nowadays for our more mild to moderate patients, or maybe our non-compliant patients who'd like to take their bandages off. We do have a 2-layer system, which is also available. This is our JOBST Compra 2, latex-free, and we do have a Compra 2 or a Compra Light. So that takes it down to, the lower compression level if they can't tolerate that 40 millimeters of mercury. For those patients that do have wounds, we also have the Compra 4 system. Now, I did throw the codes in here for this one, but understand that these are the surgical dressing codes. This does not have a lymphedema code to it, so just throwing that out there. But this does come with our wound contact layer Cutamed Sorbac, so it's kind of a nice bundle that you can use, and these can be left on for up to 7 days. But one thing I really did want to talk about too is our barrel wrap, because bandages are so huge nowadays, not only for comfort, but for ease of use, for getting that compression that we really need. And if, say, perhaps you have a caregiver that has to utilize a product or don the product for the patient, these are fantastic for them. These are patented elastic short stretch, which is very important because that's what we use in our bandaging system. So we know that we want that same thing if we're going to our Velcro devices. 50% overlap of bands mimic lymphedema bandaging. That's not an accident, and that is something that you may want to remember if you happen to take a quiz later or anything like that. This was done on purpose. Dr. Wade Barrow created this product as a alternative to bandaging, and he made it as close to the lymphedema bandaging as possible with that patented elastic short stretch and that 50% overlapping of the bands. And these do come in 20 to 30 and 30 to 40 millimeter of mercury options, which is very nice so that you know you're getting the compression class that you need very simply by just choosing which product you want.
And before you move on, I know I don't mean to interrupt, but I'm going to anyway.
Please do.
You mentioned that some of the documents that you have that we're going to have on our resources page. I actually put the link in there. Not only will it allow you to download all of the documents she's talking about, all of the cheat sheets, if you will, but it will also allow you to take the quiz that Erin mentioned right from there. So you can say, it says get your certificate, but that leads you to a quiz. So it looks very happy, and then it takes you someplace where you got to answer questions. But and you will get your certificate at the end. So check out that link. And we will give you an email for this at the end. But I also wanted to point out that on the bandages and the dressings that Erin started mentioning there, not only do we have that availability to get those, but we also have we actually own Compression Guru. And those bandages have been sold on Compression Guru for a long time, so you can get them from us through there and still pay the Guru pricing, which is amazing. So can the patients, and you can build a cart for your patient that your patient can purchase, so that you have exactly what you want. And then one other little key feature: if there are certain things that you want, like if you want certain dressings that Erin mentioned there, you can build your own and make it a kit on Guru, and we'll do that for you. And so that you can actually go and say, hey, I want the Josh Perkins kit right now, and don't go searching that because it does not exist. But you could make your own and have your kits that you like, certain arms and certain leg products, and you can order that all at once for your patient. So just wanted to point those few things out before we move on.
Yeah, I think that's fantastic. Heard about that on the first on the hacks to for Compression Guru. Yeah, and that was awesome. And how easy is that then for you when you know what you need? You just save it in there and then you order it whenever you want. That's awesome.
Sure.
Yeah. So just to kind of review also, we do have our trim to fit. So this is our compression device, our Velcro wrap that can be trimmed to adapt as the extremity reduces. So we do have it for upper and lower extremity. Really promotes independence, and these patients can tighten the garment throughout the day to get more reduction as quickly as possible. If they're really one of those compliant patients, man, the reduction that you will see with these products is really amazing. And like I said, we do have it for upper and lower extremity. And the great thing about the lower extremity is we have it in the 20 to 30 or the 30 to 40. So depending on how, light to moderate or max edema, we have one that will fit these patients perfectly to address their edemas.
Yeah, those are the products too. Those products, the trim to fit, those are the product that we most get a question on, can you bill it? And the answer is yes, absolutely. We can bill this product. So, use it. It is a daytime garment. So you can use this as a daytime garment, move the patient down when they plateau out. You can move into one of the flat neck garments that you need.
Yeah, absolutely. So just to review our fabrics, we have the Ferro Wrap Classic. Not the best picture, but I did want to put a picture in here of how it has been updated at the top right. And we have updated this product. We've improved the Velcro. It's more of a curved Velcro, which we know kind of hugs nicer to the product. And then we added kind of at the end there, you'll see that now the Velcro goes to more of a landing strip versus the actual product. So this has reduced any pilling. It kind of elongates the life of the product. And so the Velcro stays, it attaches longer and stronger with this new kind of style and design. So the Classic is, I call it the OG. This is the one that you're going to want to use for your patients with moderate to severe with those lobules. It is a nice fabric that will not sink into creases, and it can really handle those larger lobules. We do have our basic. So this is more of a value fabric in that anytime you start sewing things together, right? Like you start sewing Velcro on and things like that, it does bring the cost of the product up. So this has Velcro that is double-sided and removable, and it is trimmable bands too. So this actually can reduce with the patient as they reduce. And it's a really, really nice product. If a patient does have to pay out of pocket, you will get the best cost of this through Compression Care and Compression Guru. So absolutely go there to look for it. But this is a really nice product for, like I said, those patients that maybe need something a little bit more cost effective. But also, like I said, you can still go ahead and trim these bands so it can reduce with the patient. We do have our Ferro Wrap Strong. So this is a step down from our Classic. So if somebody is moderate to severe but doesn't have lobules and things like that, they can use our Ferro Wrap Strong. This is a nice fabric that is highly breathable. It's double laminated, soft and comfortable against the skin, but still has that containment that's needed. So you can see we have this for the full leg. This is a great product for patients that, have full leg lymphedema, but not necessarily lobules and things like that. Really, really comfortable and containing. And then, of course, we have our Ferro Wrap Light, which is for those patients that really either can't tolerate the 30 to 40 or don't need it. And so it's 20 to 30 millimeters of mercury, comes upper and lower extremity, ready to wear, custom, and trim to fit. So a great alternative for patients if that 30 to 40 isn't what they're looking for. We do have our Ferro Wrap 4000, and this is a great product. This has alternating bands. It's a little bit different from our 50% overlap, but it does have a nice inner sleeve to assist with donning. And it comes with our Ferro Wrap Hybrid Liner, which is one of those liners that has compression from the foot up to just above the ankle. And then it's a nice soft liner material the rest of the way up. So when you pair that with the 4000, you're getting compression from the toes to the knees. And this does come in tan and black, and it's 30 to 40 millimeters of mercury. And of course, we have our toe caps and our Bella Light Glove, which are trimmable. So these do come 15 to 20 or 20 to 30, which is really nice. And it does come beige and black. And you can trim these, which that just means that they come a little extra long. And so you can cut those back for patients to make sure that you're getting it to the right size for their fingers and toes. But what I did want to talk about, like I said, this is all about the science behind these products. And we do have a great study that shows how these Ferro Wraps are compared to, your traditional 4-layer compression bandages for the treatment of VLUs. And we do have this in the slide or in the documents that you can access with this, and just showing that, patients saw, we had 90% satisfaction for these patients with the ease of donning, the ability to attend to self-hygiene, which we know is huge, especially with patients that have wounds. We want to be able to clean our limbs and keep that wound safe from bacteria, etc. And they really appreciated the fact that they were able to use their regular shoes, and that comes from that Ferrule hybrid. And application time we found was 43% faster, and a 25% reduction in cost, which is also helpful, especially when we talk about costs these days for our patients and our healthcare workers. And for the nurses that utilize this, we found 80% preferred this over using those bandages simply for safety issues. Walking, they're able to wear their own shoes, and health issues, meaning we can see that wound, we can see the skin, and make sure everything is safe for our patients.
We got a question come in, Erin. Sarah's asking, does the hybrid liner have different compression levels?
So for our hybrid liner, yes, that's a great question. And I don't know if I went the wrong way. Don't know if I put that in there, but we do have it in, I think it's 20 to 30 and 30 to 40, but I will confirm that. And it will be in the information that I give you too. So yeah. Okay, and now we're going to talk about night garments, because studies have shown that night garments are huge and important for preventing rebound edema and maintaining what we got during all that treatment. I mean, you're treating these patients for 4, 6, 8, 12 weeks, and then to keep that edema when they go home and at night. It's so important. So Relax is a fantastic garment, and it really truly redefines night care, because this is for our mild to moderate patients, and this is something that is nowhere else on the market. This is a unique monofilament spacer fabric technology, and a lot of times you'll see in these night garments, because they do need to be different than the daytime garments. We know that. We usually see some foams and different things like that. This is a truly unique product in that these monofilament spacers allow us to have lower profile and much more breathable and comfortable. And it's lightweight, flexible, and slimline. Has these cool max yarns, which really make it nice. We have a lot of patients that love to put these products into the freezer shortly before they go to bed in the summertime, and then put it on nice and cool for a long time. Helps them get to sleep easily. Also, between those monofilament spacers and the dimpling, the textured surface, we're getting those high-low pressure points that really help stimulate the lymphatic flow when these patients are wearing it. But don't just take my word for it. Of course, we have a study here to refer to that showed 91 participants with lymphedema, really assessed them through comfort, fit, ease of use, heat, perspiration, impact, and quality of life, and absolutely found that so much improvement and comfort with these products that the patients were more adherent. And that's really what it's all about, getting these patients products that they will wear so that they can maintain their edema and all that hard work that they did. Now, like I said, this was definitely for patients with mild to moderate edema. But if you do have somebody that has more moderate to severe, we have JOBST. Now, if you look at a patient, evaluate a patient, and you see fibrosis, anytime you think fibrosis, I want the first thing to come into your head to be JOBST. This product was designed by a lymphedema therapist for lymphedema therapists to help with those fibrotic tissues and fibrotic patients. This JOBST has 4 different densities of foam that really help create multiple pressure points. And what that does is it just eats up that fibrosis. It's really amazing what you can find, the results that you get when you wear this with when a fibrotic patient wears this garment. So we love the JOBST for our more difficult patients. And it is amazing. We have 2 fabric options. The PolarTech Power Dry really keeps it cool and dry. But for those that have sensitive skin, we do have the organic cotton and spandex. Of course, we have all the breast and chest wall pads for Jovi. And pretty much, I always say with this, I don't think I even know all of the different pads that we have for Jovi because there are so many. So if you don't see it, when you see some of these slideshows or some of the presentations, please absolutely ask because more than likely we have it. And then also pit packs. We had a big conference this past weekend in Florida, and we had one of our favorite therapists talking about pit packs and how she uses them all the time. These are dried cherry pits put into these pads sewn in by hand that really help work on that fibrosis. And from the beginning of a therapy session to the end of it, if you utilize these, you will see an amazing difference in that fibrosis from the beginning to the end. Of course, we have Belize, amazing. This was also designed by a lymphedema therapist for lymphedema therapists. And this is really a phenomenal garment for after breast surgery. And it really is made to be worn day and night. So it is comfortable day and night, but it is approved for that night code. So you can get this for your patients, but it can be worn day and night because it is so comfortable. Our pads fit all throughout it. So those Jovi pads can be utilized with it.
Of course, before you go on, Erin, I got a couple little things here. One, Labria says, love pit packs.
Yeah,
and so there's a comment. And then a question, though, can the pit packs be put in the chest region or the axilla region?
Yeah, so absolutely. We recommend that these be utilized with supervision, especially for the beginning uses of this, because they are cherry pits. They are hard. And so they will give more compression than a traditional Jovi pad. So you just want to make sure that your patient is safe in using these. But absolutely, they can be used wherever, especially though, like right after breast surgery, and if they're going through radiation and things like that, be careful. Don't use it directly over those areas right then at the beginning. But absolutely, these can be utilized, wherever we need to work on that fibrosis. People love, especially too, putting them under the chin for the chin and the neck for our head and neck cancer patients. Man, they get so fibrotic in that area. These are fantastic for that. Okay, so real quick, accessories, of course, these are covered too. So please go ahead and always get your patients donning gloves. The Arion Easy Slide, we have it for upper extremity, lower extremity. We have the Magnite, which is fantastic for your patients with closed toe garments, because most of the times those donning devices like this have to be pulled out from the bottom of the garment. The Arion Magnite there's a little handle that you pull up from the knee area, and it opens up and allows the patient to use it with their closed toe garments. Dysum, if you're getting a Jovi, you get a Dysum. You need to get that too, because Jovi garments are push-on garments, not pull. If you've ever seen those finger traps that you used to use as kids, where you put your fingers in the side of them, and then when you pull to get your fingers out, it actually gets smaller and tighter. That's kind of how those Jovi pack garments work. So that's why we recommend you get the Dysum and you push your garment on as opposed to pulling it. And then the Cutimed of Cute, we know our patients really need that skincare. So absolutely utilizing that. 10% urea gives a nice pH balance, but also allows for real good hydration of the skin. Great thing about this too is we usually have to tell our patients that you cannot do your skincare right before you put your garments on, because a lot of the the emollients and things in lotions will break down the fibers of the compression garments. This was specifically made so that you can put it on and then put your garments on. Let it dry first, really let it sink in, and then you can put your garment on. It will not affect the garments, which is wonderful. Just a reminder too, we do have Leukotape K. Kinesiology taping, huge these days in lymphedema therapy. So we do have our version, comes in all the fun colors, but really assists in some of those really difficult areas too, like fingers and toes. I see it utilized all the time. This is a great image from a study where they were utilizing it on the chest for edema and fibrosis after a surgery. And it really utilizes the skin or lifts the skin to kind of help stimulate that lymphatic system in some of those areas that maybe compression doesn't hit perfectly.
Hey, I do have a couple
And
questions that came
oh
in.
yes,
Sorry to interrupt you. I'm interrupting you again.
please, you know me, I'll just keep talking until somebody tells me to stop.
Yeah. Brittany would like to know what garments come with some type of donning device.
So our ready to wear garments come with the slippies and the Bella or the Bella Strong, and I believe the Bella Light come with a slippy there too. But the rest of them, because they're so many different ones, especially when it comes to custom and things like that, do not come with one, but we do have the ones that you're able to purchase.
And then Lorraine is asking, is the Cutimed, and I know this may be a question that you can answer, is the Cutimed covered by insurance also?
No, unfortunately, the Cutimed Acute is not one of those that gets under the accessory code like the donning devices do. Unfortunately, even though we all know that it is super important that the patients take care of their skin, we haven't quite convinced Medicare of that just yet, I think.
Yeah. Brittany says thanks. And yeah, thank you for answering that because I was like, ooh, I'm not even sure. And I'm on the billing side. I was actually messaging my team like, hey, what about this? Give me some answers here. So
Yeah.
answering the people that are smarter than me about it. That's what I was doing. So,
yep, understand that for sure.
Thank you.
Yep. And I know we're going to have a great discussion coming up soon with Nancy Morgan about wound care. And I know you guys have got some exciting stuff going on too. So I just wanted to throw it in here that we do have an entire line and a whole division of people that take care of advanced wound care products. We have everything from your super absorbers to infection control, and then even to your basic bandage coverings and things like that. So reach out if you have any questions on those, because I will point you in the right direction. I have limited knowledge of this, but I have a great interaction with our wound care team, and they are an amazing group of people too. So
yeah, and those are products that just so everyone knows that as compression care steps into the wound care side of this industry, we will have these products and be billing these products as we move forward. And I've been working with Essity to get us stocked up on everything wound related. And we've got new forms for that. That'll actually be on that same the cheat sheet page. We'll have our forms for ordering those products available as well.
yeah, this is something I'm very fortunate that I get to work closely with our wound care team. And we just did a dinner last week, and the products that we have are so amazing in the way that they work, especially the Hydrofera Blue and the Cutimed and the infection control, which we know is a huge part of especially those long-term wounds that won't heal. And we've got such a full and complete line. It's why, I know we've been saying this forever, that we have the complete solution, but we truly do, in that pretty much anything a patient has, we can address. I mean, even down to the point, Josh, anymore, with Essity, we have incontinence products, right? And so we have everything. It's just such a full line of products, and our wound care is just outstanding. So you want to learn all about what we have, where we have it, what it is, etc. We have on our JOBST Compression Institute website. This is probably where I would recommend you go first if you're looking for any information about PDAC and things like that. So we have a whole page there that lists each of our products and each of the PDAC letters. We have them all listed there. It's public knowledge anyway, but we just wanted to make it easy for you guys to find. So if you go in there and say you want to look up the FeraWrap, you just click on FeraWrap, or perhaps Relax. You click on Relax, and then it shows you any one of the products that we have, and then the codes and everything. Now, Josh has this all memorized for all products from all companies. So
100%.
yeah. And so you really don't have to worry about that. But if you did have any questions, just to be, before you want to send anything in, just to make sure that it's covered or whatever, we have all that information on here. One of the things that I wanted to spend a little bit of time on is our training and support. As you can see here, we have 14 MAs that are spread all throughout the US. This group of individuals, I cannot say enough about. Some of them have been here for quite some time, not calling out any names, Cindy Roberts, and Mel, but they've been here longer than me, and that's saying a lot. And the experience that we have in this team, from fitters to sales to therapists, formerly treating therapists, it's beyond compare. I think one day I'm actually going to add up the total years of experience, and we probably actually be slightly frightened. But what this team can do for you, if you don't know your medical advisor, please reach out to me, and I will get you in touch with them, because not only are they hosting classes in your area or in your region almost every week, they're also they'll come into your clinic, and they will do a clinic day with you, in that line up 4 patients, and we will help you decide which is the right product and help you learn to measure them if needed, because we want to make sure that you have everything you need to be able to support your business, right? We want you to be able to make the right decision for the right product for your patient, and not to be afraid of doing it. I'll tell you, I know when I first started this, coming from treating patients, I was very fortunate. I had a great fitter when I treated. I'd probably get shot for saying this, but I didn't really think about the maintenance compression. I was lucky to have a great fitter, and I just said, thank you. But we want everyone to know about our products and how they work and why you want to choose this one over that one. So this team is there to help you with that. Now, I'm here to help too, but this team, if you need virtual support, we've got that. The great thing about this team and the size of it is let's say Peggy is doing a training today, but you need help virtually. We have 13 other people, 14 including me, that can help you virtually. We always have somebody there to be able to assist you if you need that.
Along this training lines, Lorraine asked, are there any training courses for the leukotaping for lymphedema, like there is for kinesiotaping? Or is it just used the same way? Can you give some details on that?
Oh yeah, so absolutely. I mean, there's definitely trainings out there for leukotape with lymphedema. I know Close Training has a fantastic one, and we are working to put together one for ourselves to utilize. But absolutely, I mean, it's the similar kind of idea in that it's all about the skin and the muscles and everything, but there's definitely some really cool techniques on following the lymph pathway to be able to kind of direct that lymph flow if we can. We also, one thing I did forget, but I'll talk about that on the next slide. But yes, we're working on ours for the Leukotape K, but I do know that there are some out there. If you do Google it, there you can find some other ones out there.
Awesome. And then someone else, Kelsey, asked if how they could reach out to you, because you said reach out to me. So I was I'm putting your email up right now. So I put it in there. So now everybody can yell at Erin about anything you need. Also, we've got an offer on the table here that if you need a Hawaii rep, there's an offer on the table. So
all right, nice, nice.
Just throwing that there.
And
if you need somebody to go and visit Hawaii while you're training that rep, you let me know.
Oh, I'm always the one that I'll put it out there that I'd be happy to support that rep as many times as needed. Right? Sure. Yeah. But do you want to talk about Now, we already mentioned JOBSTcompressioninstitute.com for the Lymphedema Resource Center, but training in and education is a huge, huge part of what we do here at JOBST. And if you scan this QR code, it takes you right there to the training tab. You can see we have these 4 tabs down there, but the training tab, that is where you can find all of our upcoming classes, webinars, etc. So anything that we have coming up that you would want to register for, you can find it here. We do webinars the last Tuesday of every month, unless it's around a holiday. We might kind of move it a week, so we're not doing it the day before Thanksgiving type thing. But we do have webinars set for every last Tuesday of every month. And for those webinars, we do have key opinion leaders that come in. You know, we had Brandy McEwen come in and speak in January on clinical documentation for LTA, right? We're trying to help you out, Josh. We're trying to help our therapists out to make sure that you are putting everything you need in there. Fantastic webinar that was done. Our next one coming up is Linda Hodgkins, who is talking about edema, you know, getting it from the get-go on inpatient and really managing it before it gets to stage 3 lymphedema. All of that can be found here on our JOBST Compression Institute website, along with all of the literature that you might need, some videos on how to don and doff or how to measure, all of that kind of stuff, you can find it here. One of the biggest questions I get, Josh, all the time is, I missed the webinar. That sounds amazing. How do I watch that webinar that Linda just did or Brandy just did? Path is our site that hosts all previous webinars and any self-paced learning things that you might want to do. So if you missed Brandy's webinar, go ahead and scan that QR code now. It'll take you there. You can find that. All of our webinars from last year will be on there too. And then the self-paced e-learning styles that maybe you want to go through it. You get 10 minutes here, 10 minutes there. You can kind of go through some of those along with videos and things like that. What's really nice about this too is it's not just compression. So let's say you do see wounds and you're like, I want to learn a little bit more about that hydrophare blue. That's on, you can go and you can click on the wound care therapy area, and then you can find all the learnings there. It's all free to use. You just have to go in and register or register. So register. And we also have our JOBST eShop. So of course, this is for our custom products. Very, very simple to use. Walks you through everything you need so that you can't order a product that isn't available. Because sometimes I even still get a little confused as to, can I use this silicone band on this product? Or does it come in this color? If you go in here and you put your orders in here, it will not allow you to choose a color or a band option that is not available. I absolutely love it because it also gives you a gut check on your measurements. This one looks a little out of range. Are you sure? And maybe you entered 25 instead of 52. So, this is a really great way, especially if you are a newer measurer, then this will help kind of get you into the flow of what you need, because yes, the order forms have a lot of information on there and they can get a little confusing, but this will walk you through it so that you don't even have to think about it. And then that was my presentation, Josh.
Awesome. Sue Ellen has said that the QR code for the Brandy webinar didn't work. And sometimes those QR codes can do that. So, or the QR codes, I think I just said QR kids, I don't even know. But sometimes the QR codes can break. So we'll make sure to get you the link. I'll get I'll put your name down here. So I want to make sure that we get you the correct link, unless Erin can post that real quick. I have also posted in the chat a link to a Teams meeting that is going on all day long. It is our lounge You can hang out in there. My team members are there. Erin, you are welcome to go over there if you do have a few extra minutes. Jump in there, answer some extra questions if you want to, or just hang out and chill with some of my team there. I will try to make it in there sometime between noon and 1 today, Central Time, for just a few minutes, just to say hey to everybody. But I do have team members in there running the whole thing today. And then also I put another link in there in the chat for compressioncare.com/big day of training resources. That is where you can go to find all of the cheat sheets and all of the paperwork that Erin has been talking about today. You can download everything there. You can also click on the get your certificate and take that magical quiz. So we definitely appreciate it. Sue Ellen will take care of you for sure. And any other questions that we're going to have? Doesn't look like I got a bunch of thank yous. So thank you, Erin. And I appreciate everyone who was here on this meeting today. Thank you so much for being here and supporting us. Erin, as always, you're awesome. Thank you so much. I really do appreciate you being here and doing this. Stacy, Stacy missed how we get certificates. Very simple. There's a link in the chat just a little ways up here. I'll put it. Well, I thought I was going to put it on the screen. All I did was break it. There we go. This link right here, that website, and you'll have to click it from the chat, but that link will actually take you over to the Big Day of Trainings page, and from there you can click on any of the documents, or it says get certificate next to each class that you've attended, and you can just click on that. You will have to take a quiz, and then the certificate will be made and sent to you via email, but you'll get it from there. So, but thank you. I really do appreciate everybody. For those of you who are going on to the next class here, I'm very excited to see you here shortly. And for those who had to jump onto this one and may have a patient coming up next, have a great day and enjoy yourselves. I really do appreciate you. Thanks again, Erin.
Thank you.
All right, we'll see you. Bye.